So guys, yesterday being 11th of March, the UK government published a guidance on the health and care worker visa to clarify all that is going on, which I am going to be sharing with you guys in today's video. So today's video will be well detailed. I hope you guys will watch from the beginning to the end so you will not miss any part. Hi beautiful people, welcome back again to my YouTube channel. If today is your first time here, my name is Stella. If you have not subscribed to my channel, what are you waiting for? Please do not forget to like, subscribe and share my videos. Click on that notification bell to get notified whenever I post any new video. And for my returning subscribers, thank you guys for the love and support. Honestly, I really do appreciate. So on this channel, I talk about my life here in the UK, what is happening around me, and I share information. So if this content sound like what you'll be interested in, then do not forget again to do the needful. Just like, subscribe and share. Well, in today's video I'll be sharing with you guys what was published yesterday, 11th of March, on this health and care worker visa, because so many persons have questions to ask. Please, a quick disclaimer, I am not an immigration solicitor, so all I share are based on my experience and research. Like I always say, you can make this research for yourself. All you need is to go on your Google and search for whatever you are looking for. Like I said, I'll always share with you guys the latest update. Well, without wasting much of your time today, let's go straight into the government website. Before I talk about this, please, if you have any question that you're not clarified with, personally, I would encourage you to better meet an immigration solicitor for all your questions. It will cost you money, it's true, but personally that is what I will do. If there's something I don't understand or something I see online that I am confused, I'd rather pay, even if you for 30 minutes or for an hour, just to get some sort of clarification from from the professionals, people that are good with what they do, instead of listening to side talks. They say have put so many persons into trouble. So I'll advise you, if you're in the UK at this point, you're still confused, then you're better off paying an immigration solicitor. Like I said, it will cost you money because these people don't joke with money. But personally, I'll tell you, you're better off meeting a solicitor to explain everything that's happening now. Well, on the government website, which was published 11, that was yesterday, said health and care visa guidance. And you guys will be seeing everything on the screen. What it says the guidance is intended to provide information on health and care visa. The health and care visa is part of skilled worker visa. This guidance came into force on 15 February 2021. You all know that this carer job was never on the shortage occupation list, so it was added that period, and they started recruiting from overseas and all of that. And he went further saying, as the health and care worker visa currently form part of skilled workers, anyone wishing to apply for health and care visa must meet all the requirements from the relevant route. So guys, he went further saying, in fact, I don't want to read all of this. It's so many things to read and understand, to be honest. But at this point, I think I'll just go straight to the point where you want to hear, what you want to hear and what you want to know, because there's no point of me reading all of this article. Like I said, it's as simple as that. All you need to do is go on your Google and type in gov.uk and you can read all of this. Like I said, it was published yesterday, the 11th of March. Here it says, number 3, it says, the health and care worker visa will apply to the following list of standard occupational classification code. So if you're looking to apply for any health job, these are the standard code that you should be going into. The first one is 1181, that is health service and public health managers. I always say this, if you want to apply for this managerial role, personally I would encourage you to apply for MVQ level 4 and level 4, level 5, stuff like that. I said this in my previous video. I said I have my MVQ level 4 and I did an interview for deputy manager role, but the job was in Durham. It's Durham, I think it's Durham, but I am not ready to relocate to Durham, and the job was like I think they were said is 4 days in a week, 4 or 5 days in a week. And to be honest, personally, at this point of my life, I don't think I need a day job that will be going Monday to Friday because of my kids. My husband works full time, so I will have to work with what will should I say favor us or what works for my family. So at this point, I don't really need that job. So if you are in this situation and you think you can go for this managerial role, I will encourage you to go for NVQ level 4, level 5, and trust me, you come back and thank me later. There are so many opportunities out there. But But the truth is that most people just focus on this healthcare job, care assistant. You can do it. Just apply for an MVQ and say, I won't say it's easy. Nothing is easy. But with hard work, trust me, you will get there. Anyways, he went further talking about this code. Code 1242, that is residential day and domiciliary care managers and proprietors. Code 112, biological scientists and biochems. So if you're in this field, you should also, start applying for job in that field. Social workers, like laboratory technicians, auxiliary nurses and assistants, dental nurses, care workers, and senior care workers. This occupational code should be the code if you're looking to go into health. These are the codes you should be applying for jobs with sponsorship, because they are still on the shortage occupation list, and these jobs in this field can sponsor you. So just go through it. You must not apply for senior carer or carer's job, to be honest. I know some persons have been working in health sector, so all you need to do is to take this occupational code and start applying for that particular field that you're trained for. You never can tell what will come out, to be honest, because at the end of the day, I feel like this healthcare job is everywhere. Everybody's applying for it. So why not go for that particular job you're being trained for? Do you understand what I'm trying to say? So they also made some sort of clarification, especially those persons that are saying, now that we're in the UK, what will happen to our children? Does that mean we'll send them back home? That kind of a thing. Well, this is what it says on the government website, because I feel like this is one of the questions some persons have been asking on the comment section. If you submit your health and care visa application from 11th March 2024 with a certificate of sponsorship for 6145 care workers and home carers or 6146 senior care workers, you will be unable to include your partner or dependent in your visa to come to or stay in the UK. Guys, did you hear that part? You guys can see it on the screen. It says if you submit your health and care worker visa application from 11th of March. So for those of you that submit your health and care worker visa application on the 11th of March, can you hear what it says? I'm not the one that is saying this, and like I said, I am on the UK government website, so you can also go on the website and hear what it says. And under it says, this restriction will not apply to skilled workers or health and care visa holder with visas issued for applications submitted before 11th March 2024, or if the dependent is a child born in the UK. Some persons were saying, what do they mean? So people that have children, will they send them back home? Look, they clarify it again. They said dependent born in the UK, meaning if your child is not born in the UK, there's nothing you can do about it because it's there. So these are the people that are exempted. So let's say now you have not applied for your visa or you've not started the process, because today is what? Today is 12. The other thing is that if you give birth in the UK while you're on this skilled worker visa, your child is exempted. So for those of you that came to the UK with your children, you just have to look for another plan. And I always say that the best plan is to go and meet a good solicitor. I said good one that know what they are doing. They will give you the best advice on what to do and what not to do. They all know this game, so don't go and be asking people and be making decisions for yourself. And personally, I will never encourage anybody to stay illegal in this country, because it's not worth it. The country itself is already stressful, so do not even stress yourself by saying illegal. I think I saw in an article that said UK marked the second most miserable country. Can you believe this? So it's not worth living in this country illegal. So if you're confused at this point, because I don't want to keep reading, to be honest, there's a lot there. All you need to do is to meet a good solicitor. Personally, that's what I would encourage you to do, because it's over. There's no more dependent. There's nothing you can do. And if you're already in the UK, the plan B is for you to meet a solicitor, or if there's any country you wish to travel to, you can also consider that. Because if you have children in this country, there are still some other ways, do you understand, that you can still stay in the country with your children. Yes, but like I said, I'm not an immigration lawyer. Go and meet them, they will explain better to you guys. Well, with this, we've come to the end of today's video. I have been seeing some of your messages asking me questions on this, and I hope that this have clarified your answers. If you apply on the 11th of March, you cannot come with your dependent, is there. And if you apply before the 11th of March, you can come with your dependent. And if you're already in the UK now, that is already too late, you cannot come with dependent, and you give birth in this country, your child is exempted, meaning your child can still stay in the country as your dependent. Well, that is it for today's video. If you find this video interesting and informative to watch, do not forget to give this video a thumbs up, like, subscribe and share, and do not forget to leave me a comment on any type of video you would like me to make. I'll see you guys in my next post. Bye guys.